In the interest of community service, Power 88 presents live talk shows to inform, enlighten, and to stimulate thought and dialogue. The views expressed on this program are not necessarily those of the staff and management of KCEP or the EOB. Now sit back, relax, and enjoy the program, or call in and participate at 647-3688. Funding for community partners for better health on KCEP Power 88 is underwritten by the Southern Nevada Health District. And here is your host.
Morning, Las Vegas. My name is Ciara Owens, and I'm so excited to welcome you today on this ashy, smoky Wednesday morning for a healthier tomorrow. Will, how you breathing today? How you feeling?
I'm feeling good, but I'm not breathing too well.
Oh, can you say it? So what are you sitting there doing today to protect yourself? Because I got a message saying I needed to wear a mask, and I forgot it walking my dog.
Well, that's the thing you do is you wear the mask. Pretend it's 2020 with COVID out here because the smoke is choking you up.
That part. So y'all, protect yourselves, cover your face, limit your exposure outdoors, but we know some of us, we have to do so. But please, please, please take care of your lungs and take care of your body.
And this was a good reminder to change your air filters too.
Oh, well, you know, mine need to be changed really bad, like the car and the house.
Change them both. Got to keep those lungs healthy. Got to breathe.
That part. So how you doing? How you taking care of yourself this past 2 weeks?
I got my water bottle right here, so I'm doing that, trying to sleep, get 7-8 hours. Don't always succeed, but if I aim for it, I get closer. And you know what I've been doing too is spending some time in silence.
Oh.
Yeah, just sitting in silence and allowing myself to be present.
That's a powerful thing. It's crazy. I have not been realizing how I haven't been really breathing on a regular until I took a deep breath at a birthday party on Sunday, and it felt like it gave me energy and entire life. So that is what I've been being really intentional with this past week, is just breathe. So
let me tell you, breathing will change your life.
It will.
It sounds so basic and so simple, but okay, no shame, no stigma. I understand people use assorted products when, they're trying to indulge in life. But that breathing action where you take that deep inhalation at the hookah bar or wherever else you might be, that is physiologically changing you, and you can do it without the tobacco product. If you just take that deep breath, you're going to feel better.
Yes, in 2 seconds. So y'all, if you ever find yourselves feeling overwhelmed, close your eyes, take a true deep breath, hold it in, breathe it out, and you'll sit there and make it a great day. So we know the Healthier Tomorrow radio program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. September is National Childhood Obesity Awareness Month. Raising healthy kids is a family affair, so get the whole family involved. The best thing you can do to help your child achieve the healthy body that you need to do them right is for us to create and practice healthy habits every single day. For more information, visit gethealthyclarkcounty.org, and we'll be able to dive in. This is all we're talking about today is childhood obesity and our healthy practices.
Yeah. And when I was a childhood, obesity wasn't really talked about. It wasn't. We just were different back then. But it's so important today to really talk about this because it is something that is detrimental to our long-term health. And health, the foundations do start in childhood. So we want to bring on our first guest. We've got Dr. Stephen Shane on the line with us this morning, and we're going to talk a little bit about some obesity facts. So good morning.
Good morning.
So glad that you could be with us. Thank you for calling in. I just want to make sure I got a little information about you right. You're up in Reno at Renown, is that right?
Correct.
Awesome. Well, see, look at us bridging the northern-southern divide. I love this.
Yes.
Well, so talk to us a little bit this morning about your background, what brought you to this work, and what's the 5210 program?
Well, my background is pediatrics, and I've been interested in helping kids with unhealthy weight. Oh gosh, probably for about 10 years now. It's been a passion of mine, and over the last few years, I've become board certified in obesity medicine to help hone my skills in treating my patients who have overweight or have obesity. and we just recently started a healthy lifestyle clinic here at Renown Children's Hospital to, focus services on kids who need help with their weight.
Awesome. And can you tell us a little about the difference between obesity and being overweight?
Well, in children, we use body mass index, and we use percentage based on how kids compare with their peers based on their age and gender. So when their percentile for body mass index is 85 percentile or higher compared to their peers, we call that overweight. And when they get to 95th percentile or greater, we call that obesity. And it's kind of a proxy for body fat. What we're really worried about is body fat, and the body mass index is an easy way to measure, and it's a repeatable thing to be measured in the office that can kind of give us a good feel for someone's degree of body fat.
So, Dr. Shane, thank you for clarifying the difference between overweight and obesity. Do you mind really diving in and what it means for Nevada's program for 5210? What does that mean?
52110 is a very easy to remember, simple message that's composed of 4 healthy behaviors. The 5 is for 5 or more fruits and vegetables daily. The 2 is for 2 hours or less of recreational screen time. The 1 is for 1 hour or more daily of moderate to vigorous physical activity. And the 0 is for 0 sugary drinks. So it's a great, healthy foundation messaging system that works across all ethnicities, cultures, backgrounds, and easy to remember.
So as far as it goes, I love it. Like now I'm going to sit there and I'm going to say when I'm looking at a meal, this balance is my day balance. Not even just a meal, it's my day balance in my 5210. So as far as it goes, who overall promotes this inside of Nevada? Because this is the first time I've heard about it.
Well, the state of Nevada over the last 2 years has been developing a program that's based on 5210 messaging. It's called Nevada 5210. And it's part of a broader umbrella called HEAL Nevada, which stands for Healthy Eating and Active Living. So it's a program that falls within that umbrella. And at this point, we've developed a website, and this is the Division of Public and Behavioral Health through the state of Nevada, a website that has resources for providers, schools, early child care facilities, workplaces. We've been trying to attract, up until this point, healthcare providers, but now we're trying to expand interest and uptake in these other sectors across the community.
So in Nevada, we seem to have a large population that have obesity, not just in children, but in adults as well. Can you share a little bit about who's most impacted?
Yes. Just like the rest of the world, the nation, obesity prevalence has been increasing over the last 5 decades and continues to increase. And obviously the COVID pandemic augmented this increase. Currently in Nevada, about 1/3 of adults report having obesity. And unfortunately, there are certain ethnicities where this prevalence is higher, and this includes Hispanics, blacks, American Indians, and Native Alaskans tend to have higher prevalences of obesity. And this holds true for adults and children. And in children, depending on where you get your data, but probably 1 out of 5 to 1 out of 3 children in Nevada who are school aged have obesity currently. So a lot of kids are suffering with this disease process.
Can you give me that stat again?
Yes. 1 out of 5 to 1 out of 3 children, depending on which data you look at, in Nevada will have obesity. And then obviously if you throw overweight in there, it can be as high as 1 in 5, or 1 in 2 children may have overweight and or obesity. Yeah.
That's 50% of our kids.
Yeah, so pretty shocking.
So Dr. Shane, there's 2 questions that I have for you. One, what do you feel like is causing the rates to increase in certain populations such as the Black, Hispanic, and the Native American / American Indians?
Yeah, I mean, obesity is a very complex illness. I think for years, many people thought it was related to willpower, people not willing to be active enough, not eating properly. But now we're, appreciating that it's a very multifactorial process. And a lot of it's genetics. Probably 40 to 70% of weight is determined by genetics. So obviously, you can't control your genetics. And then obviously there's a lot of disparities in things such as healthcare, access to food, education, the things that we call social determinants of health. And then it comes down, and then there's obviously, personal factors. So behaviors that, for kids, a lot of that is related to family behaviors. So it's a very complex process, is the bottom line.
Thank you. And my last question is, we've sit there and looked at the 5-2-1-0. So 5 fruits and veggies a day, 2 hours or less of screen time, at least 1 hour of physical and moderate activity. And the hard part is the 0 sugary drinks.
That's the one I don't like.
That's the one. Everything else, I'm like, okay, I'm with you. Everything else. So talk to us, Dr. Shane. What are some things that we can drink outside of water? Because we know that we need that, especially here in the desert. What else can we drink as alternatives? Because I think that out of the entire plan, everything sounds absolutely great and dope, but that one sounds like the most difficult to do.
Yeah, that is difficult because it's been shown that about half of the sugar calories that kids get come from sugary drinks, and that includes juice, 100% fruit juice. So other than water, and we all need lots of water. I mean, 2/3 of our body is water. And obviously, you mentioned desert, so it's certainly important in our environment. Other things that could be healthy, you could use water with freshly cut fruit or vegetables to provide flavoring to your water. Mineral water with natural flavoring without added sugar or other sugar substitutes is another healthy option. Low-fat milk is certainly another healthy option for us to drink as well.
Awesome. Well, my last question.
There are some options.
Yeah, it sounds like, and I do love when I put like my squeeze of lemon and a little cucumber in the water. That just makes me feel real good.
There you go.
So. My last question though is simply, does this actually work? For my clinical experience, 5210 messaging does work in individuals and families. Looking at population data, the 5210 message started in the state of Maine out of a program called Let's Go back in 2006, and they've been keeping very good data since that time period. And they've shown that since and it takes a lot of years, a lot of participation within a community to get that message through to folks. But since 2020, they've shown that their obesity prevalence has decreased. And from 2022 to 2023, that obesity prevalence has been remaining stable, which is wonderful just because in most of the areas of the country, it continues to rise. They've also shown that in the youngest of their population, as far as behaviors go, main rates either number 1 or in the top 3 for number of fruits and vegetables consumed daily, and also the least amount of sugary sweetened beverages consumed daily. So at least in the state of Maine, where they've really
have dived in all into this program, they're starting to see some real successes.
Awesome. Well, Dr. Shane, thank you so much for joining Healthier Tomorrow today. One more question is just how do people get involved? Because I want to make sure folks know how to connect with this messaging.
Yes, in the southern part of the state, the Southern Nevada Health District has been promoting 5210 messaging for a while now. And the website to go to is gethealthyclarkcounty.org. And if you go to that website, there is a link for 5210. The northern part of the state, Northern Nevada Public Health, on their website has 5210 resources and information to get involved as well. And then there's the state program that I already mentioned called Heal Nevada, which is HEALNV.com. So you can go to that website no matter if you're a parent looking for more information, a school, a daycare, a healthcare provider, or run an after-school care program. We want everybody to be involved because the more sectors of the community that get involved, the more effective this kind of messaging and healthy changes can occur within a community.
Thank you so much, Dr. Shane, for this information, and I greatly appreciate it. I'll definitely be applying 5210 into my own personal lifestyle.
Yeah, go for it.
You have a great day. Thank you, Dr. Shane. Yeah, my pleasure. Thank you for having me. Of course. We'll help to help you again. So September, as we mentioned, is Childhood Obesity Awareness Month. This is a chance to promote healthy habits among children and ensure that every child has an opportunity to seize optimal health. Healthy bodies comes in all shapes and sizes. Rather than focusing on your weight, let's keep focus on your health and what you can do to encourage and foster healthy behaviors. The 5210 recommendations are 4 simple steps to help you build healthy habits in children every day. To learn more, visit gethealthclarkcounty.org. All right, so the man with the plan. We have a representative from Clark County School District Food Services who told me that he creates the menus that our babies are enjoying every single day in the 5th largest school district. Jake, go ahead and tell us more about you.
Yep. So I do all the menus, except for the special diet menus. That's done by one of our other dietitians. And I'm a dietitian, so dietitian nutritionist. We kind of put that nutritionist in there just because a lot of people don't know what a dietitian is, but we focus on nutrition. Most dietitians are employed in hospitals, and they'll give you go over cardiac diet with you, different diets when you're, in the hospital. I kind of wanted to go the other way and try to do preventative nutrition. So that's why I'm glad to be working for CCSD Food Service and planning the menus there. And then besides that, my past was an entertainer. So Las Vegas born. I used to do Tournament of Kings here, a bodybuilder over there.
Tournament of Kings. They have the best tomato soup. I used to work at Excalibur a long time ago.
Oh, you did? I need an autograph now because that was my favorite show growing up.
Yes!
I'll sign it. Nobody will know who I am, but I'll sign it. But yeah, so that's. Oh, and I worked for 8 Parades in Nevada at one point, so I'm really deeply into the community and love the Southern Nevada Health District, 3 Square, and all the different community partners.
You're plugging a whole bunch of things because we have a community event that we want to highlight for AFAN a little later in our show. So we love here at Healthier Tomorrow to be proactive and not reactive. So I love that you sit there and said you wanted to be a part of that plan with Clark County School District. Let us know, what is CCSD doing to help alleviate some of these challenges that are coming with the statistics that we just talked about with Dr. Shane?
So a lot of people don't know, but we're highly regulated by the USDA. When your child goes to school, we're offering them fruits, vegetables, whole grains. We have to meet a certain calorie. We can't offer them too many calories. We can't offer them too little calories. The amount of salt that we offer them, we have to make sure that goes under a certain limit, So we're trying to offer a balanced diet. We also at the high school level have salad bars for the students, and then just always trying to promote those healthy meals.
Wow. I didn't have a salad bar when I was in high school.
You better say that part. I was excited to get the Jimmy John's pizza. I'm sorry, the Papa John's pizza.
Yeah. Oh, and we do have Domino's too. So like we were talking off mic earlier, we try to make the meals healthy but also appealing to the students, because we know that the students want to look and eat recognizable foods for them. So if we started doing like quinoa salads, we probably would have a drop in participation.
Yeah. So in your pre-interview, we talked about schools having share tables to help reduce waste. Tell us a little more about that.
So this happened way before I got to CCSD, but it's a great initiative. So the students, when they're taking their meals, they have to take a certain amount just so the government reimburses us. But if the students don't want to eat like their bag of carrots or their bag of grapes or maybe the low-fat Dorito chips that they get, they can put it on the share table, and then another student can take that home with them if they're hungry. So that helps to reduce waste and also feed another student that might want that food.
I think that's so important. I'm not a fan of food waste, and I do understand, kids can be picky. So this is a great solution to both of those. There's also a challenge in our community with just nutrition insecurity, so folks being hungry. Can you tell us a little bit about what the school district is doing to ensure our students are not hungry?
So we provide a breakfast, a lunch, a supper at most sites. Other sites we provide a snack at. So we try to provide the kids with as many meals as we can. And like I said, with the USDA regulations, those are all nutritious meals that the kids can eat. Also, it's been documented that school meals are some of the most nutritious meals that kids get all day long, because like you said, they might not have those foods at their homes.
So what are you doing in particular? You sat there and talked about they may not have foods at their home. So we know that they're getting breakfast and lunch during the day. What are you doing in the evenings?
At the evenings, we have, well, it's not really evenings. I don't want to misrepresent it.
I appreciate that.
So we do have suppers at most of the school sites, where the kids, they do need to eat on site. But that's what we're doing about that. As far as like take home meals, we're not really in that realm of things. I know the schools have separate programs. Yes. Some of them do.
Yes.
Yeah.
Hands down. So as we sit there and talk about this, and you talked about someone else does the other, dietary restrictions and whatnot. And I just think this is important because we talk about the world is changing. So now we have different preferences. So what are you able to accommodate when it comes down to dietary restrictions for our students versus what are you unable to accommodate?
So our other dietitian is great. She's able to accommodate most other diets, but it has to be, the parent has to get a doctor's note, so it has to be medically required. And on ccsd.net, they've got the form that they would need to fill out and send to her. But she's got like gluten-free diets, she's got like low-protein diet, she's got low-carb diet, she's got just like lactose-free, just tons of different diets for students. But it has to be medically necessary. And then if a student can eat a regular meal, I would suggest that they eat a regular meal, just because you get a lot. Anytime you limit your foods, you're not going to get the variety that you could if you're not limiting foods.
So I remember coming up, and I don't know about you, but we used to have like the lunch menu on the fridge that would sit there and come out on a monthly basis. Where do we find that information now? Do we still get it printed out and we have it on the fridge, or is it online?
It's online, and you can print it out if you want to. And I always add an S to this, so I got to make sure I look at my notes and make sure I don't add an S to my menus. Menu.ccsd.net. So it's menu.ccsd.net. The parents or the students can go to that site. They can click on their student's school and they can see what they're having for breakfast, lunch, supper. And it's a great thing because it updates automatically. So if I don't get a truckload of the fiestadas that I'm supposed to get that week and the school has to change it to another menu item, it changes on site. So it's always up to date. So unlike those printed monthly menus, you'll see in like 2 days or a day. It takes a tiny bit to update, just like anything. But they'll see the changes at their school.
Awesome. Well, we're wrapping up with this segment, but thank you so much for being here. Before we let you go, I want to get a scope of just how many meals you are actually serving.
So we serve a ton. We serve approximately 150,000 lunches per day. We do about 60 to 80,000 breakfasts per day. And then just in August, which is a slower month because, we miss a week and it's the first month of school, we did 3.3 million total meals.
Oh, wow.
Yeah, we're a little busy.
Just a little bit.
We're a little busy.
A little bit.
Well, thank you so much for joining us this morning on A Healthier Tomorrow. Thank you for the work that you're doing to keep our kids healthy and for being one of the amazing folks from the Excalibur Show. How cool is that?
That part.
Tournament. All right. Thank you again, Jake.
Thank you.
All right, y'all. So we have some community events that are coming up, and Jake gave us a segue for plenty of things. So AFAN, which is Aid for AIDS of Southern Nevada, Southern Nevada, my apologies, has the Black and White Party 2024, which is celebrating 40 years of service this Saturday at the Palms, and it starts at 8 p.m. I promise y'all this is probably my favorite fundraiser that happens in the entire city, and it is a great time. There's also plenty of discussion about food distribution because we're really leaning into childhood obesity and making sure that a balanced diet really leans in. So at the center, every Wednesday of the month, every single Wednesday, there's free food distribution from 9:30 to 11:30 a.m. at the center, which is at 401 South Maryland Parkway. It is first come, first serve while supplies last. There's also a pop-up market that is handled by the food pantry for providing balanced meals, and that is also happening today from 11:30 to 1 p.m. Or while supplies last, and you can find more information on that at jfsalv.org.
Great events, great things happening in our community. So really excited about that. Ciara, it's always such a pleasure to be with you.
It always is. Well, I enjoyed. I missed y'all 2 weeks ago.
Yeah, we missed you too, but we still had a good time.
Always.
But it's a better time when you're a part of the party.
Thank you.
And to our audience, thank you as always for tuning in every second and fourth Wednesday right here on the People Station, Power 88. I'm Will Rucker.
And I am Ciara Owens.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately. And follow the 5210 plan, too. Why don't we do that?
That part. And put your mask on today, Vegas. Put your mask on.
All right. We'll see you next time.
Bye, y'all.